Good morning again. I'm Paul Kowalski. I'm going to be the moderator for this podium that kind of looks like a talk show from television. And I promise, because I'm moderator, these individuals will not talk over themselves like The View and all those other annoying television shows. First to speak is Ms. Julie Kruse, Policy Director for the National Center for Healthy Housing, Chair, National Safe and Healthy Housing Coalition.
Oh, you're not introducing everybody?
I was going to go one at a time. Don't forget by the time we get to the next one.
Okay. I just want to say, we're up here to talk about changing the conversation to healthy housing and lead poisoning. And I just am really excited to be here with these mystery panelists who you will be introduced to one by one. But we are half healthy housing folks and half creative folks. So we've got an artist, a writer, and then me and Brenda, who you already know. So we're excited to mix it up a little bit here. When I over the break, what made a computer crash and get us 5 minutes late? I don't know if all of you saw the picture of Dr. Jocelyn Elders up there that I had up for just a few minutes. Anyway, it was a picture of me and her at the White House in July. So one of the best things about this job is I got to work with one of my all-time heroes of all time, Dr. Jocelyn Elders, our former Surgeon General under President Clinton. But this is an amazing woman who does not like taking half measures. So when she was the Secretary of Health of Arkansas, she increased the screening rate for 2-year-olds tenfold and doubled the immunization rate for those 2-year-olds, and told me stories about her and Rosalind Carter going in helicopters and landing in fields and finding these little kids in their houses and immunizing them. So it was really exciting because she really cares a lot about lead poisoning. She talks about how in this country we don't have health care, we have sick care. And as the prayer speaker made clear, that takes care of 10 to 20% of our health problems. But health care is about prevention. And so in July, she went to the White House and then to Capitol Hill to tell folks, look, we did solve 90% of this lead poisoning problem, but we have 10% left. And the difference between this and other epidemics, it's, as the prior speaker said, 100% preventable. This could be our big public health success story of the 21st century, is to eliminate lead poisoning. But to do that, we have to create the political will, and that's why we have changing the conversation to healthy housing and lead poisoning. Lead poisoning should be up there. And we want to talk about ways to do this. And you are all the heroes of this movement. And I was brought on at the National Center for Healthy Housing, not because I have any healthy housing or lead poisoning prevention experience, but because I've worked on campaigns that have won. And every campaign I've ever worked on that has won has been because grassroots voices overcame the din of other talk, overcame, in a lot of cases, powerful interests and money, and I'm just excited to say, as grassroots voices, we can win out over all of that and successfully do this, but we have to be really intentional about it, and actually I found you have to be really creative about it, because you do have to cut through all the noise. I'm a policy director, I do a lot of lobbying, and in Congress people have what I call shiny object syndrome, so we have to turn this into a shiny object, or people will not care about it, I'm afraid to say. So I'm really excited to be up here with some really smart folks to help us think about how to do this. These are kind of obvious. I did want to do, because people like this at these conferences, so this is a little bit of an aside, but because I am the policy director for the National Center for Healthy Housing, I wanted to mention, we're the organization that really leads the fight on the Hill for funding for HUD's Office of Lead Hazard Control and Healthy Homes. And what?
Childhood lead poisoning prevention program also.
And yeah, CDC's about to get there. See, okay, you gotta get her under control. I think you should stop this stuff. Okay.
One at a time, she's got another 10 minutes.
This is why I like Brenda. She keeps us on our toes. And for CDC's childhood lead poisoning and healthy homes and lead poisoning prevention program. And we work with partners to also increase funding in other areas like the EPA, like the childhood asthma program at CDC, and also right now HUD is fighting for its life for funding, and there's lots of other funding. The home program is an $800 million block grant program that allows states to do HUD projects that fill in the gaps, and a lot of money of that is used for rehab and creating healthier homes. And the Senate just voted to cut that from $800 million to $66 million. So we're part of a larger fight to have Americans care about safe, decent, and affordable housing on this 50th anniversary of HUD, while there's some real intentions to decimate it. And I'm also the chair of the National Safe and Healthy Housing Coalition, which is our kind of grassroots network, which we hope you join. It's free. Leha, who did the prior introductions, they sit on our steering committee. And Brenda is here as our, she's the co-chair of our policy work group, which is a really amazing group, which you can join as well. I just want to tell what the current funding environment is and why this work is so important to lift up your voices. So, in terms of HUD's Office of Lead Hazard Control and Healthy Homes, I think actually the program peaked at like $210 million, but I just put up 2003, it was at $176 million. You got to add 3 zeros to all these numbers. And then for 2015, which is last year, the funding was $110 million. I say it's last year because fiscal years in Congress start October 1st, so we just started fiscal year 2016. And as you all know, the government almost shut down last day in September, and then we got funding continued through December 9th. So we're still in this battle just for 2016. We requested, with many of you signing on, which is very, very important, because we'll see with the CDC numbers what happens when people are not raising their voices and saying this funding is important. But we asked as a coalition for a $10 million increase to HUD's program. So did the president in his budget. And the Senate did pass level funding, so no funding cuts from 15 at $110 million. And out of a $40 billion HUD budget, which is looking at being reduced to $37 billion, Senator Collins, who's the chair of the HUD Appropriations Subcommittee, specifically mentioned lead poisoning prevention, that she's been doing town hall meetings on this for 18 years and that she will not cut this. Even though the House voted, as the full House of Representatives, to cut the program by a third, by $35 million. So, the fact is we were really worried with the Republicans taking over the Senate would we be cut, and we have a really wonderful Republican chairwoman of the key subcommittee that people in Maine have been talking to really effectively for a long, long time. And that's just how important this is. Because if she had decided to cut it by $75 million, not by $35 million, it'd be a done deal. And this is just the history of HUD funding over time. I guess it did peak in 2003, so. But you can see if the House proposal goes through, that's a really substantial cut. Moving to the CDC's Healthy Homes and Lead Poisoning Prevention Program, I think a lot of you know this story, that it was, and sorry for those of you who saw these numbers in my presentation yesterday, I'm being repetitive, but the big cut was from $29 million in FY11 to $2 million, basically eliminated the program, and I think a lot of you suffered through that, and we've done a lot of documenting what happened in states, but people basically lost their personnel that were doing this, and then you have to rebuild that. So we asked, there was a really big fight that a lot of you were involved in, and we got the funding back up to half its former level. But this is what happens when you take your eye off the ball. And a lot of our programs were clamoring for help, and we weren't quite clamoring quite enough. And this is when the Democrats were in charge, and Democrats who supported us, we just weren't clamoring quite enough. And so we asked for an increase again, and right now it looks like it's probably headed towards level funding. And then this is the graph showing the history of that. But I just wanted to say the budget's in really tough shape, and when we send out alerts to say, call your members of Congress, tell them that HUD is important, we can't be cutting HUD by $4 billion, Americans need safe, decent, and affordable housing, and Congress needs to lift the budget caps, that we really want you to engage on that. So turning back, but that's why it's partly important for this conversation to be happening, because the consequences are dire if it's not. But we want the conversation to happen bigger and not to just be about level funding, but to actually fighting and eliminating lead poisoning. So I'm really excited to say with the National Safe and Healthy Housing Coalition, Brenda and Chris Corcoran from Connecticut and I did a reception just like we did last night. But we did one last April in Orlando at the conference. And we asked people, what do you want the National Safe and Healthy Housing Coalition to do? Just like we did last night. And people told us, and so we have rolled out a campaign based on what folks said they wanted us to do, which is just raise awareness about this field, bring more resources into the field, and help us move towards where we're solving this problem. So we have the 5 Things You Can Do campaign. The first thing you can do, and this is all up on our website, they did a workshop on this yesterday, but ask your member of Congress to come to your program and learn about what you do. If you don't ask them anything specific about legislation and you just educate them about your program, that is not lobbying. That is just member education. It's only lobbying if you mention specific legislation. So if you're not allowed to lobby, don't talk about the 110 million, 75 million. Just tell them how important your program is for your community. And we have all the tools there. We tell when are members of Congress going to be home in your district, here's a letter to invite them, here's talking points to use with them. Everything you need is on the website. We're asking you to encourage other people to join the coalition, especially if they're from red states. And the other people in this panel will be talking about telling this story, but when we had our Hill Day last February, these are pictures of kids, of family members that came to our Hill Day, and those family members handed those pictures of those kids to their members of Congress. And of course, that's more effective than anything else in terms of telling your story. Those members of Congress now have those photographs and those kids from their districts that they can think about when they think about the budget. And I'm really excited we have Tom Beller, who got an op-ed about New Orleans and lead poisoning into the New York Times. And when you see something like that, that's a great opportunity. Anytime something is published about lead poisoning at all, whether it's Freddie Gray's lead poisoning, whether it's new studies coming out, you can send a letter to the editor and get more attention locally. And then the last thing is we're trying to get creative and engage people through the arts, and that's where the rest of this will be. So I'm going to turn it over to our next speaker.